All right, we're gonna do the palpations and special tests for the elbow and the forearm. So we have our lovely patient here. We're gonna do medial and lateral epicondyle. So medial here, lateral here. We have the ulna, we have the radius, we have the olecranon process.
Just the tip, right there. Yep.
We have the humerus underneath her gigantic biceps, our monstrous biceps. UCL is going to be right here.
Right in there.
Right in there. Biceps brachii right here. Triceps is going to be on the posterior part. And then the ulnar nerve, right where that UCL was in there. So moving on to special tests. These are fun ones. We got valgus and varus. Start with valgus. So I'm gonna hold you here, and then for valgus, we're going like this. Mm-hmm. So I'm gonna cheat. I'm gonna push in.
Don't push that way. Push this way. It's like, yeah.
Gotcha. Oh, that's what we're testing. Okay.
Yes.
Gotcha. Okay. Any pain there?
Mm-mm. And if there's no stop to it, what does that mean?
Torn.
Which ligament are we looking at?
Here we're looking at the UCL.
Yeah.
UCL is going to be right here.
Yeah.
So then the opposite, our valgus, we're testing the UCL that's right here. So I'm going to use my left hand, kind of pull towards me. The right hand, I'm pushing towards her. And then for varus, I'm going to do the opposite.
Stay on the other side of me. It helps it makes it easier.
Yep. Gotcha. And we're looking for, again, damage to the RCL with varus, UCL with valgus. We have milking signs, so I'll have her put her arm up into a 90-degree position. And then I'm just going to pull her thumb straight back.
Yeah, and support the shoulder so it doesn't move, so it's only looking at the UCL.
Gotcha.
Yes.
Any pain there?
Mm-hmm.
Awesome. So then we'll do moving valgus or moving milking sign. And so now we're going to stay here, and we're going to take her into various degrees of motion.
Yep.
All the way down to 30 degrees. For Tinel's test, we've done this before, but this time we're going to do it on the elbow. So we're going to tap in between the medial epicondyle and the olecranon process. So that would be back here.
Same in the same gap where the ulnar nerve is.
Perfect.
Mm-hmm.
Any shooting pain or anything like that? Sweet. No ulnar nerve pathology or cubital tunnel syndrome. And then we have golfer's elbow test or medial epicondylitis test. So I'm going to be doing this one fully myself. I'm going to I'm going to supinate, extend, and then extend her wrist.
And make sure you have your hand on my medial epicondyle for this one.
People.
Mm-hmm.
Okay, so we're gonna go
start like this.
Supinate, extend.
Yes.
That makes sense, of course. And then resistive tennis elbow. So I'm gonna hold the patient's hand, and then I'm gonna resist her as she goes into pronation and wrist extension.
Yes, and then palpate the lateral one this time.
Okay, lateral, so you're gonna go here and then push up.
Yes. So you're gonna resist me on it though. So you'll let me do it, but not well. Yeah, there you go.
Gotcha.
Yep.
Okay.
Perfect.
Awesome.